Hi, I'm Robert Perez, a patient of Dr. Pollard, and I'm here today to talk to you about my experience of my aortic replacement valve with Dr. Pollard. Well, the main symptoms that I was experiencing actually had to do with fatigue. Fortunately, I didn't have any kind of pain like most people do, but I was really dragging at the end of the day, and I noticed that fatigue was a major problem that started developing with me. What made me choose Dr. Pollard actually was a big help with my main cardiologist, Dr. Hans, and actually once meeting Dr. Pollard in our pre-surgical meeting that we had, I knew he was the right doctor for me. The way Dr. Pollard explained the procedures and different options for me was actually at I think it was a couple of days before the surgery itself, a pre-consult, if you will, that we had at his office. He was very thorough. He actually used some of the props he had. He showed me the different ways of, and the different, tissues that can be as a valve replacement. So that was very comforting when he did that for me. All the questions that I had were actually addressed by Dr. Pollard. Of course, one of the main things for me was after the surgery, of course, what kind of pain was going to be involved and so forth and so on. And he put me to rest regarding that. He'd make sure there was going to be very minimal pain regarding that. Dr. Pollard's bedside manner and his communications were tremendous, especially not only prior to the surgery, but immediately after the surgery. He was one of the first individuals, along with the staff, that I actually saw once I came out of anesthesia. That was very comforting, and I was very thankful for that. The nurses and office staff at the Baptist Medical Center were very helpful, very much like Dr. Pollard's. From everyone who checked me in at 5 a.m. all the way to taking me to set up my IV and all that. Working in conjunction with Dr. Pollard were just so helpful and made me very comfortable. My recovery so far has been excellent. I know that my faith in my Lord Jesus Christ has healed me. However, I also know that the recommendation from Dr. Pollard and my cardiologist, Dr. Hans, to continue with what's called cardiac rehab at the hospital was a big plus. And I was able to complete the cardiac rehab, and it's just been such a great thing for me now. I first started noticing how I started feeling better after the surgery about 10 days right after. It was pretty quick. The activities have gotten a lot easier for me to do. I don't have that fatigue any longer. I'm actually stronger now in many different ways. So I'm still limited at this time as to what I can actually lift for obvious reasons, but things are just getting better and better every day. What I would say for anyone that's nervous or any anxiety about needing an aortic valve replacement, first things first, I always say pray for sure. And again, that's my faith. Pray, have that inner peace with you. And it's amazing what God can do and bring people together like he brought Dr. Pollard and his staff to me. And it was just, it puts your mind at ease when you have the right people giving you that love and compassion and the comfort of knowing you're going to be okay. The way I would describe Dr. Pollard and his team, again, is if you want someone that's professional, someone that's thorough, someone that's compassionate, and it's going to be there not only before and during the surgery, but after the surgery, that'd be the description that I would use, and I'd highly recommend Dr. Pollard and his staff.